Hi, Hannah. I'm your neurologist, Dr. Dennis. How are you today?
I've been better. I'm experiencing a lot of pain starting in my right shoulder and all down my arm. It's really painful to move.
I'm sorry to hear that. I see in your chart here that you had a stroke about a year ago. Is that correct?
Yes.
Okay, so tell me more about this pain you're experiencing. Is it like a shooting pain? Does it ever feel tingly or numb?
Well, both. When I reach up to get cups and plates out of the cabinet, I feel a shooting pain. And then when I'm just laying down watching TV, it's tingling.
Any stiffness or abnormal sweating?
Both.
Okay, so taking a closer look at your arm, I can see that it's significantly more swollen than your other. It appears to be red, splotchy, and warm to the touch. Um, and I see here that you've already been tested for Lyme disease and countless other generalized muscle diseases, and arthritis, and infection. And your X-ray and MRI scans both show no underlying damage to your bones or tissues.
Yeah, I've been tested for everything and I feel like I haven't gotten any answers.
Please tell them you have some answers for us today, Dr. Dennis. My mom's been through so much.
Well, Hannah, I think we found the answer you've been looking for, because given your history of having a stroke within the last year and your current signs and symptoms and your extensive lab and test workup that haven't led to any other conclusions, I believe you have what is called complex regional pain syndrome.
Oh, Dr. Dennis, what's that?
Well, we aren't exactly sure what causes people to develop complex regional pain syndrome, but it can happen to those who've experienced a recent trauma or injury, which in your case was probably the stroke that you experienced last year. So I'm going to prescribe you some gabapentin to help with your pain, and I'm also going to refer you to occupational therapy. They can help you a lot with managing your pain and getting you back on your feet. So do you have any more questions for me?
No, that sounds great. Thank you so much.
All right, I'm so glad we got to the bottom of all this. Taylor, our nurse, will be in here shortly. It was great to see you, Hannah, and have a great rest of your day. And I hope you start feeling better soon.
Hi, Hannah. My name is Taylor. I'm going to be your nurse for today. I know you're experiencing a great deal of pain in your arm. I'm here to give you information about your gabapentin prescription as well as answer any questions that you have.
Hi, nice to meet you. My biggest concern is the medication. I've been on medication before that hurts my stomach, so I'm just a little anxious about that.
I totally understand that. Overall, gabapentin is a safe drug to use, and I'm confident that it will help your pain. But some side effects are nausea, vomiting, clumsiness, diarrhea, dry mouth, and drowsiness. But a lot of these are preventable if you take your prescription with food.
Oh, okay, great. That makes me feel a lot better. If I don't feel like the dose is working, can I just double it?
No, if you are experiencing any symptoms or feel that your medication is not working, I recommend you call our office. We don't recommend you take more than your current dosage because it can lead to more severe side effects. But other than that, do you have any more questions or concerns for me?
Nope, that's it. Thank you so much.
Absolutely. I'm going to give you a handout of everything that we discussed today, as well as the points of contact for our office if you need to get a hold of me or anyone else you're speaking to today. Your occupational therapist, Macy, and your occupational therapy assistant, Lauren, will be in here shortly.
Okay, great. Thanks.
Hi, Hannah. I'm Macy. I'm going to be your occupational therapist, and I know you've been experiencing some pain and some other symptoms, and so my job is going to be to help you manage those symptoms and get what you were doing before you started having all these symptoms. And this is Lauren, your occupational therapy assistant.
Hi, Hannah. Nice to meet you. Macy and I are going to be working together, but I'm going to be working with you one-on-one in the sessions. Can you tell me a little bit about what parts of your daily routine you're having trouble with and when you're experiencing the most pain?
Overall, I just feel like I'm slowing down and I'm less productive because of the pain. When I'm cooking in the kitchen or cleaning, it takes twice as long because I have to take breaks and it's just hard.
And your daughter has been helping you with some of the self-care and household things around.
Yes, I recently moved back in and I've been doing a lot of the cooking and the cleaning since it's very painful for my mom. I really would like her to get back to her normal life and so she could get back to teaching her kids at school.
Oh yeah, awesome. Okay, so Hannah, we are going to start doing therapy, and we are going to first and foremost focus on reducing your pain, and we're going to help improve any motor skills that may have been lost during this time, and we are going to also focus on teaching you some energy conservations to help you with how tired you're getting throughout your day. So as of right now, I was thinking we could start with one session a week for about an hour and just see how that goes. Do you have any questions at this time?
Nope, that sounds great.
I'm looking forward to working with you, and I'm going to look into incorporating art into some of our sessions.
Yeah, I'm also looking forward to working with you, and I'll be in touch soon. So I'll go ahead and let the front office know about your next appointment so you can get started.
Great, thanks.
Complex regional pain syndrome interventions. So my article was Heartbeat Enhanced Immersive Virtual Reality to Treat Complex Regional Pain Syndrome. The participants included adults with upper limb CRPS after upper limb trauma or stroke. The procedure was 24 patients with CRPS and 24 age-matched healthy controls who used a virtual reality headset that showed a virtual depiction of their affected limb. The limb flashed synchronous to their heartbeat and asynchronously in the control group. The results showed heartbeat enhanced virtual reality reduced pain readings and increased grip strength. These positive results were absent in the control group.
My article was Immersive Virtual Reality for Pain Relief in Upper Limb Complex Regional Pain Syndrome. Participants were recruited from an outpatient rehabilitation clinic who were experiencing CRPS in at least one upper limb. The procedure was an immersive virtual 3D kitchen that was designed to allow visualization and manipulation with virtual hands. Participants performed the task representative of daily activities as well as guided visualization sessions for a total of 10 sessions over many weeks. Overall, participants reported subjective improvement in their overall abilities to complete activities of daily living and reported that they experienced less pain.
So this article was the effects of mirror therapy in stroke patients with complex regional pain syndrome type 1, a randomized control study. The participants were 30 adults that were first-time stroke patients with CRPS type 1 of the upper extremity. The procedure was that the patients were divided into two groups, a control group and a test group. Both of the groups received therapy, but the test group also received mirror therapy in addition. And the results were that both groups saw improvements with therapy, but the test group saw significantly more. And the test group also had increased motor function and decreased pain with the mirror therapy.
This study was the impact of mirror therapy on body schema perceptions in patients with complex regional pain syndrome after a distal radius fracture. The participants were patients with CRPS1 developed as a result of a distal radius fracture, and the patients were divided into an experimental or control group. Both had exercise therapy and medications prescribed, but the experimental group also had mirror therapy implemented. And the results were that the majority of the experimental group had improvement in their body schema perception after 6 weeks, while only 35% of the control group showed improvement.
The next article was a randomized control study that looked at the effectiveness of fluidotherapy in post-stroke complex regional pain syndrome. And there was 30 total participants, 30 hemiplegic patients with subacute stage CRPS type 1 of the upper extremity. And there was two groups, and all 30 of the patients were randomly divided into one group which received a conventional rehabilitation treatment program, and the other received both the conventional rehabilitation program plus 15 sessions of fluidotherapy to their affected upper extremity. And both groups showed statistically significant improvements, but the experimental group showed greater improvements in edema and pain detect scores.
This article was the effectiveness of transcutaneous electrical nerve stimulation in the management of patients with complex regional pain syndrome. It was a randomized, double-blind, placebo-controlled prospective study. There was 30 participants total with either stage 1 or 2 CRPS, specifically type 1 in the upper extremities. The 30 patients were divided into two groups. The first group received TENS therapy for 20 minutes for 15 sessions, and the second group received shams 10 therapy for 15 sessions as well. The results showed that there were improvements seen in both groups, but group 1 received TENS therapy for 20 minutes saw improvements in pain intensity, edema, neuropathic pain, increased range of motion in the second and third fingers more than the shams 10 therapy group did.